The United Mitochondrial Disease Foundation, through research, support, and advocacy, is committed to finding a cure for this disease. We work very hard to find pathways to new treatments and support our families that we serve.
I remember August 16th, 2011, a doctor called, and we had narrowed it down quite a bit. And she said, we found what was wrong. She has mitochondrial deletion syndrome, called Pearson syndrome. And I just stopped because I said, I remember that one was the one I didn't want. And when you, as a parent, you read life expectancy age 3, that's not what you want for your firstborn child.
Our families are faced with a real challenge of diagnosis. You know, many of our families see 20 or so doctors before they're diagnosed. And our organization is committed to remedying that as much as we can. You know, part of our effort is educating doctors throughout the country and throughout the world about mitochondrial disease so we can improve the pathway to diagnosis. Our work in Washington is centered on a couple key initiatives. When we think about the rapid growth of genomic medicine, part of that is keeping up to provide access for our patient families and coverage for genomic testing as well. So we spend quite a bit of time focused on that. And of course, we are extremely focused on making sure that the NIH is funding these initiatives. We fully support and work very hard to bring that to light for our families.
My message to them as a mom would be that the clock is ticking, that there are so many people out there with hope, and that is it. And they're watching their kids go into the hospital and fighting for their lives and fearing that they're going to be lost. So to work diligently and very committed to what you're doing, because there's a lot of people waiting for your research.
The United Mitochondrial Disease Foundation and We Work for Health Pennsylvania share a common goal. You know, we are committed to providing for the best for the patients and families we serve. And that comes through a variety of different areas, whether that is working through Congress to make sure that we're providing access to our patient families and passing legislation that will improve their care and their pathway to a cure, whether that's funding great research or just our collective mission to doing the right thing for the patients and families we serve.